Hi all, I am Dr.Shilpashree, Senior Consultant in Obstetrics and Gynecology, Fertility Specialist and a Laparoscopic Surgeon. Today I have chosen the topic Thyroid Disorders. So I'll be concentrating on both hypothyroidism as well as hyperthyroidism, but mainly I'll be speaking about hypothyroidism. Thyroid gland is situated in the neck. We all of us know this. It's the most important gland which controls the body's metabolism and promotes growth. Thyroid gland secretes hormones like T3, T4 and calcitonin. Any disturbance in the activity of this gland, either it is hyperactive, it is called hyperthyroidism, or it is underactive, it is called hypothyroidism. This can affect women, not only women, it can affect men also, and it can affect women and men in any age. But mainly today I'll be concentrating on thyroid disorders in women. So, when it affects the woman, people think it only affects in the reproductive age. But let me tell you, thyroid gland can affect women right from the time of their birth till menopause or even post-menopause. So what are all these effects caused by this abnormal thyroid gland and its hormone secretion in a woman's life? When it comes to age-wise classification, first I'll tell you how it affects when it comes to puberty or just when she attends menstruation. So it can affect this thyroid gland disorders, either hypothyroidism or hyperthyroidism. It can affect as early as she attends puberty or even late. So how does it affect? She might complain of very little bleeding or very heavy bleeding or intermittent bleeding. That is, in between the periods she might spot or she might not get a periods at all. When it comes to reproductive age, the thyroid gland mainly affects the egg release formation, that is ovulation. So what happens is, you may say that she is getting a periods regularly, but because of this thyroid, because of the hormonal imbalance, she might not be producing eggs at all. So this is how it mainly affects in the reproductive age. Mainly it is hypothyroidism which affects. Sometimes when it is severe hypothyroidism, she may also complain of milky discharge from her breast. This is because a prolactin, a hormone from pituitary, is involved, and there will be increased prolactin secretion, which leads to milk secretion in reproductive age. When it comes to pregnancy and postpartum, mainly it affects a pregnant woman in the form of either causing miscarriages or preterm deliveries or stillbirths. Some women say that all the scans, everything was fine, but all of a sudden I'm not able to feel the baby's movement, and the doctor did a scan and said the baby is no more. Or the baby is all right till she delivers, and once it is delivered, they say the baby is no more breathing. This can all happen when there is a thyroid abnormality. The other things is, after delivery, she might tend to bleed heavily, which is called postpartum hemorrhage. The uterus, instead of contracting, it might get over relaxed and she might tend to bleed continuously, irrespective of whatever injections and medicines give. This is because of the thyroid disorders. So this is how it affects in the pregnant ladies. When it comes to postpartum period, mainly it leads to increased weight gain, decreased milk secretions, and also amenorrhea, that is, she might not get a periods at all. So that's how it affects in the postpartum period. When it comes to menopause, it might lead to early menopause, which is very, very common. Even at the age of 35, 37, women starts attending menopause. It might lead to hot flushes. The menopausal symptoms gets aggravated when you are having thyroid. Hot flushes, increased mood swings, increased depression, increased anxiety, and sudden body aches. Why body aches? As I told you, this thyroid gland also secretes this hormone called calcitonin, which is the most important hormone which is required for the calcium secretion in the bones. This hormone will be secreted in deficient amounts, so the calcium in the bones starts decreasing. So she complains of knee joint pains, and she complains of body aches, pulling sensation in the muscles. So this is how usually the thyroid affects women from her puberty till menopause and postmenopause. Sometimes thyroid, when it is underactive, I said we call it as hypothyroidism. In the early stages, we might not face any symptoms at all. just a slight variation in the periods or the flow duration might become reduced, or the amount of bleeding might be reduced. Later, when it is not treated for a longer time, that's where the thyroid gland starts showing symptoms like increased weight gain, joint pains, infertility issues, heart issues, hair falls, then body aches. That's how it goes on increasing. Or else she says, I don't get periods at all, or if I get periods, I bleed for a long time, heavy bleeding. Or she says, in between the periods I start to bleed, whenever I have intercourse I bleed. These are all the things they start going on telling once the thyroid is not controlled for a longer time. They say, I feel extremely cold, in spite of wearing socks also I feel extremely cold. I am severely constipated, my skin is losing the glow, dry skin, my voice is becoming hoarse, my muscles are aching, my cholesterols are raising. I don't eat anything, but still my cholesterols are increased. That's because I told you thyroid gland is the most important gland which controls the entire metabolism in our body. So anything you eat, it has to be metabolized well. So whatever you are eating, it is not metabolized, it is getting accumulated because your thyroid gland is not functioning well. So don't neglect thyroid. Thyroid is a very important gland. If it completely controls your entire body system. And they say, like, suddenly I feel my heart is like, I can hear my heartbeat sound, palpitations, and I feel always lazy, lethargic, and I think nowadays I am feeling like I'm forgetting things. I'm not able to remember where I kept what. Hair is like completely falling in spite of using good shampoos and all. So these are all the symptoms what the thyroid gland patients disorders, thyroid gland disorders patients present with, and mainly it is hypothyroidism patients present this. Some people will also have a visible enlarged glands also. When it comes to the newborns, most of the women in pregnancy, they don't screen themselves for thyroid. Usually what I do is I tell my patients, as soon as your pregnancy is confirmed with your baby's heartbeat scan, I tell them to go for a complete antenatal profile where we screen for your thyroids, your diabetes, your blood group, your hemoglobin, any urine infections, and also whether you have any infections like HIV, HPSAG, HCV. When such investigations are missed and you are actually suffering from thyroid but it is not noticed, you can pass on this thyroid disease to the infants. So how does the infant, the newborn kid present with? You can see that the newborn kid completely shows yellowing of the skin, jaundice they say. Why again? Because the liver of the infant is not able to metabolize the bilirubin, that is the enzyme which is produced by the baby's liver, because of the defective thyroid gland. And you see the complete yellowing of the skin, yellowing of the eyes, and you feel the tongue is large and it protrudes out. So what happens? It finds difficulty in breathing and it cries with a hoarse cry. And you can see the umbilicus, the belly button, there is a hernia. When it cries, now you can see a bulge. And you see always the baby, you are having some difficulty in feeding the baby because the tongue is protruding out, it is not able to suck well. That is one thing. So since it is not being fed well, there is a lag in the growth. So baby is not growing according to what it actually has to grow. It is not meeting the growth chart. So failure to grow. And you feel your baby is constipated, not passing too much of motions. Yes, it is sometimes common for babies not to pass motions for 2 to 3 days, but not on a regular basis. Definitely if it has been prolonged for a longer time, you have to meet your pediatrician because maybe thyroid testing might be required in the fetus. And some babies, they sleep excessively, like how adults suffer from increased fatigueness. Even babies can also have excess sleepiness. So but don't get confused, because usually newborn kids up to 1.5 months, they sleep a lot, they don't feed well, and all those are common. But it's always better to cross check with your pediatrician whether it is common or you need to investigate the kid for the thyroid gland. Because I will tell you, if at all it is not diagnosed and treated at the initial stage, it might lead to both physical as well as mental retardation. So when it comes to children, how does it affect? Well, before puberty, you see that they are not growing well according to what they have to grow. Their height might be small, their weight might be small, they're not meeting the growth chart, their stature might be short statured. There might be delay in the development of the permanent teeth. The teeth development might get delayed because again the calcitone in the bones, the calcium in the body is being affected, and sometimes there may be a delay in attending puberty, that is one more thing. And sometimes there may also be a poor mental development also because of the undiagnosed thyroid in children and teens. So always watch out for the symptoms. Talk to your doctors, your pediatricians, your gynecologists. Cross check with them whether is this normal or something, any investigations has to be done or not. So now when it comes to what are the causes which can lead to thyroid disorders, definitely it is the lifestyle nowadays, because we are leading a very unhealthy lifestyle, like lack of exercise, eating too much of junk food, fast foods, and the most commonest is radiation hazards. That is one thing which we all are exposed to. And Hashimoto's thyroiditis is something which is again a cause for this thyroid disorders. What is this Hashimoto's or autoimmune disease? See, what happens is when our body's immune system starts producing antibodies to our own tissues, it starts producing antibodies to its own thyroid glands, and it makes the thyroid gland hyperactive or underactive. So that is something which is not in our control. This is a genetical cause. It may be a genetical defect itself. This is something which is not under our control, but definitely there are so many other conditions which we can actually prevent from getting into thyroid disorders. Like I told you, exercise daily, lack of exercises, increased junk food eating, increased cheese, mayonnaise, and all this corns, baby corns, broccolis, gobi manchurians. They who eat a lot, they are more prone for all this thyroid disorders. And some people, they would have got exposed to some occupational hazards or some treatment medications. Like when you're suffering from psychiatric or depression disorders, we use a medicine called lithium to treat that. So patient on a long term, when they're on a treatment for this depression or psychiatric disorders, this lithium which is present in them can also affect the thyroid glands. So that is one thing. The other thing is if you've undergone any thyroid surgeries, if any radiation exposure or any cancer treatment, when that time the thyroid gland might get damaged and you'll be prone for getting thyroid disorders. And the most commonest nowadays is congenital hypothyroidism. What is this congenital hypothyroidism? I have already told you. If the mother is having thyroid and if it is passed on to the infant, and if it is not treated at the early stage, that's where she can pass on this thyroid disorders to the newborns. The other conditions is pituitary disorders. There is a pituitary gland in our brain. So when you're late night sleeping, when you're sleeping late nights, working in night shifts, you're more prone for stress and lack of pituitary hormone secretion. So that's again a cause which can lead to thyroidism. Pregnancy, which is most common. As so many women say, I was never thyroid, but when I became pregnant, I developed this thyroid disorders. Yes, as I told you, what happens is when you become thyroid, because of the so many hormonal changes and your immunity system, it starts producing antibodies to its own tissue, that is the fetus. So your thyroid gland might not be able to function adequately. So some people develop thyroid disorders in pregnancy, and most of the time when you are post pregnancy, the thyroid really goes off. But what I say all my pregnant ladies is keep checking your thyroid hormones very frequently, because once your thyroid, the tendency of it going after the delivery is common, but there is also a chance that you might be carrying this thyroid disorder throughout your life. Other thing is iodine deficiency. When we are not using iodinized salt, that is also a cause for this thyroid disorders. So always use iodinized salt. Who are all the risk factors who develop this thyroid disorders? Mainly they say women, but nowadays we see men also getting affected, and it can affect at any age. When there is a family history, definitely. When there is any autoimmune disorders, especially type 1 diabetes, they are more prone for developing this thyroid disorders. When you have undergone any radiation therapy for any type of cancer in the body or any thyroid surgery, they are also very prone for developing this thyroid disorders. And as I told you, pregnant ladies, they are also at high risk of developing thyroid disorders, because the fetus is an external, a foreign body for your body, because it carries 50% of your husband's DNA as well as genetic genes. So your body might produce antibodies to that fetus. So that's when your thyroid gland might not be able to function and produce the hormones required. So it can become hypothyroid or hyperthyroid. So what are all the complications of this thyroid disorders? As I told you, the neck might get swollen, weight gain, hair fall, constipation, dry skin, mood swings, early menopause, infertility, mental and physical retardation in children. Definitely, the other things is heart related issues, and when a pregnant woman is not treated, giving birth to abnormal babies is something which is very common nowadays. And let me tell you, the most commonest thing is when you're hyperthyroid and you're over treated with hyperthyroid medications, you might develop hypothyroidism. So we always tell my I always tell my patients why you should some patients ask me, I have just checked my thyroid test 4 months back, 5 months back, ma'am, should I really check? Yes, you need to check, because I don't know whether the dosage I have given you is sufficient, or it is overdose, or it is underdose. I come to know only when I recheck your thyroid. So it is very important to check your thyroid levels, especially your TSH levels, frequently when you're already having a thyroid disease, when you're pregnant, and when you're in your menopausal time. So if you keep checking your TSH levels, we come to know whether the dosage what we have given is adequate or overdose or underdose. So this is the reason we tell you to frequently check your thyroid. Please keep this in mind and pass on to your friends and families. So now what are the treatment for this thyroid disorder? So how do we keep this in control? Definitely exercising, lifestyle changes, avoiding junk food, late night sleeping, eating lots of green leafy vegetables. Now what are the foods which you have to avoid when you're suffering from thyroid? Gobi, cabbage, baby corn, soya, some say also palak and broccoli. These are the things which you have to be controlling. So now, when do you know that you're being over-treated for hypothyroidism? When you feel your appetite is really increased irrespective of taking thyroid, you're increasingly putting on weight, or you've been sleeping more than what you used to do, lethargic. That is where you're being over-treated. You can feel your heart's beat palpitations. That's also a indication that you've been over-treated. So it's a time you have to meet your doctor and also get your thyroid tested. So these are the things what I wanted to discuss today, mainly about hypothyroidism. Very soon I'll be making a video on hyperthyroidism. Hyperthyroidism is not so common. Basically it is hypothyroidism which is more common and it affects more. So that's why I've chosen this topic. If you have any doubts, please get back to me and discuss your problems. I'm here to help you out. How do you contact me is by messaging on WhatsApp 9739463172. You can register a consultation with me and get answers to all your queries. Thank you.